دكتورة عايشة الحربي an infectious disease clinical pharmacist.
Thank you. طيب, السلام عليكم. Thank you for your invitation. I will keep it plain and simple. So, okay. So today I will be talking about mastering the art of writing research proposal, a step-by-step strategy for crafting persuasive and successful research proposals. Those are my objectives: to identify a key component of research proposal and develop the ability to write a clear, concise, and persuasive proposal, and to conduct an effective literature review that critically evaluate the evidence, and lastly, to understand the ethical aspects of the proposed research. So before starting to go through my research, I'm sure most of you have had an experience in writing proposals. So what were the difficulties that you faced in writing your proposals? Anyone faced any difficulty while writing a research proposal? What was the difficulty? Is there a specific step that you suffered with, or? Okay, so generally يعني كان في أي difficulties? Dr. Khalid, have you faced any difficulties in writing research proposals?
Yes, previously.
Okay, do you have any specific things that you struggled with, or every new research is a new struggle? Okay, so basically different researchers may have different difficulties in writing research, either in the writing process or in choosing the right outcomes and defining the outcomes and other steps while writing the proposal. So basically it's the blueprint for the intended study, where you detail your research and your proposed project and the methodology to be submitted to the research committee for approval. So basically it describes what will be done, how it will be done, and justify why this research is relevant. So the objective of the proposal is to inform about the planned work and to convince the decision maker that this work deserves to be pursued. So the research proposal should be able to address those questions. What do you propose to study? What's the research gap that you hope to fill? What's the methodology that you will use? How you will obtain your data? And what are the main objectives of the proposal or the proposed study? And those are the components of the proposal, including the title of the research, the introduction, aim and objective, research design and method, which we'll be talking about in details, ethical consideration, budget, timeline, and citation. And most of the research entities provide a template that you should follow or fill in your proposal in. So first, the title of the research. So a research title should summarize the aim and the purpose of the proposed project. The key element for an effective title is clarity. Definitely the title should be cleared and reflect the main objective of the study. It should be concise, brief, not more than 10 to 15 words. And it should be specific with highlighting the main variable and the study design, and it should be relevant and consider the audience of the field of the study. So let's take an example. You want to study high-dose tetracycline in the treatment of carbapenem-resistant Acinetobacter baumannii pneumonia. So this was the suggested title. What do you think about this title? Tetracycline use in MDR Acinetobacter baumannii. So ايش رايكم في هذا التايتل؟ It's a short title. It doesn't specify the disease. It doesn't specify the organism. As we said, it's carbapenem-resistant Acinetobacter. It doesn't specify I'm studying what. I'm studying the efficacy and safety. It's not specified. So it's too short, not specific. And it used abbreviation, which was MDR. And the study design was not specified. So do you have any suggested title for the project?
Yeah, we can say the evaluation of the cycle. We can be specific in critically ill patient with multi-drug resistant infection as a bucket. So to be more specific.
Yes, excellent. So, okay. So my suggestion was the efficacy and safety of high-dose tigecycline in carbapenem-resistant Acinetobacter baumannii pneumonia, a multi-center retrospective study, or we can use Dr. Khalid's example, which was also a specific title. So tips to finalize the title: revise and refine, seek feedback from other experts, and check the title for uniqueness. Now we move to the second part, which is the introduction. So the introduction should answer the following question: what is the topic being addressed, why it is important, why it is significant, how it affects the current state of health, why this research is important and relevant. We should highlight the need for this research, how it contributes to the practice or to the existing knowledge. We should highlight the gaps in research that we hope to fill, and what's the study objective or research question. It should be clearly stated. And so basically, the introduction will be written in the proposal, and then it will be written again in the manuscript. So my advice to write it from the beginning in a very clear way. So when you transition to your manuscript, you have the introduction and the method section at least ready. So the introduction section structure includes a paragraph for the background information, another paragraph for the literature review, then the research gap, and the aim of the study. So for the background information, you should add any definition and terminology related to the disease that you are studying, the disease epidemiology and statistics. And why epidemiology is important? Because those numbers reflects how this disease is common and important to be studied, and including morbidity and mortality rates, why the topic is relevant, and the clinical guidelines or standards of care that already there on the topic. And then we move to the literature review, where you should provide an overview of the current knowledge and points gaps in the literature. So basically, the characteristics of the effective literature review include summarizing the literature. So you will read the previous study related to your project, you will summarize those studies, you will highlight and assess the strengths and weaknesses. So basically, you found high-dose tigecycline studied in, let's say, critically ill patients. However, it wasn't studied in the medically ill patients or patients outside of the critical illness setting, or patients with hepatic failure. So you should highlight the strengths and the weaknesses of existing literature, which will then lead you to identify the research gap and pinpoint the area where research is still needed. And lastly, it will justify the new study by highlighting the gap. So the gap was high-dose tigecycline was not studied in MDR Acinetobacter baumannii pneumonia. So this was my gap, and it justified me doing the research I'm proposing. And the literature review should be up to date. So we are in 2025. It's not acceptable to reference studies from 1995 or earlier. Use updated reference list. And the key element in the literature review, it should be clear, it should be objective, evaluating the literature in an objective, non-biased voice. It should be precise, organized, and the sources should be cited. And you should avoid plagiarism, which I will talk about briefly in the later on slides. And then after evaluating the literature, you should identify a clear research gap. It should highlight any inconsistencies or limitation in the existing literature, and it specifies unanswered questions. So mainly usually it's like, it remains unknown that, for example, tocilizumab is safe in renal failure patients, or to date, no studies has investigated the effect of this medication on a specific study. So the introduction should flow very consistently. في البداية we gave background information, then we evaluated the literature, and after evaluating the literature, we identified the weaknesses of the existing research, and then we moved to the gap, and lastly to the aim of the study, which should be a smart aim. specific, measurable, achievable, relevant, and time-bound. So specific, it should clearly state the primary research question or hypothesis. It should be measurable and achievable. For example, you cannot aim to see how many cultures are resistant to daptomycin while your institution don't test for daptomycin resistance. This is not an achievable aim. You will not be able to execute the study, and it should be relevant. You should choose an aim that is relevant to current issues. For example, in infectious disease, multi-drug resistant organisms are a very relevant issue to the current practice, and it should be time bound by specifying a realistic time frame. So you should avoid broad or vague statement. You should be specific as much as you can, and start each aim with an active verb, such as to examine, to determine, to assess, to evaluate. You should avoid terms like to explore or terms that are not clear unless it's accompanied by more specific language. And you should ensure that the stated aim is appropriate for the chosen methodology. For example, we know that causality can only be proven by RCTs, so you cannot propose to prove causality by a research and then the research design is a retrospective study. Okay, so it should be relevant to or appropriate to the study design, and it should be feasible to address given the available resources. Okay, so for example, this aim, the effect of amoxicillin in pediatric, it's vague, it lacks specificity, and it does not indicate the context of study, and it's not a SMART aim. So to formulate a SMART aim is to assess the efficacy of amoxicillin in treating acute otitis media in pediatric patients admitted to tertiary care hospital between 2018 and 2022, which is a SMART aim. So the key point in the introduction section, it should be concise, engaging, and provide the readers with a clear understanding of the purpose and the scope of this study, and it should logically flow towards identifying the gap in knowledge that you hope to fill. So basically, actually, when reviewing a proposal, you can understand the thoughts of the researcher. قد ما الريسيرشر هذا يكون فاهم الايديا وافكاره مرتبه حيبان it will be reflected in the proposal. There are some proposals that we receive, the ideas are all over the place, and يعني the flow of the introduction is not clear at all. So this means that the researcher ideas are not flowing يعني logically. And make sure to include any landmark studies, and this is very important. Do not ignore landmark studies in the field that you hope to study in, or any studies that are similar to yours. It's a weakness. If there is a study similar to your study that was not included in your proposal, you should highlight the strength and the weaknesses of this study. By ignoring those studies, you might give the reviewer an impression that this study, you actively ignore it because it's يعني, very similar to your study, so there is no need to conduct yours. So it's very important to include those studies and to review them and write their weaknesses, so it will be clear that your study is still needed and should be conducted. And remember, any unknown in the practice field is a potential research idea. During your research, you will find even more ideas to be executed. So always keep track of those. Design the method, I will be summarized in this section since it was highlighted by others. It should explain the procedure that you will be doing to achieve the objective. This section should include the design and setting, the population, outcome definition, sampling method, data collection methods, and data analysis plan. So for the study design, as highlighted before, the studies are either observational or experimental, such as RCTs, and the observational studies are either comparative or descriptive, as previously was mentioned. So you should mention and specify the study design by describing the type of the study. Is it retrospective, prospective, cross-sectional, and so on? What's the setting of your study? Is it going to be a single center or a multi-center? You should specify that in the proposal and add what's the main center for the study, and the duration or the period that you will conduct the study in. In addition, the study population, you should clearly define the group you will study. Those are critically ill patients admitted, for example, between 2018 and 2025, or patients with baseline renal impairment, pediatrics, and so on. And also, you should clearly define your inclusion and exclusion criteria. And one of the common mistakes, repeating the inclusion and exclusion criteria. For example, the inclusion will be adult above 18 and the exclusion is pediatric below 18 years of old. You shouldn't do this. Do not repeat yourself. If you wrote adult above 18 years of age, then that's enough. You don't need to repeat it in the exclusion criteria. As for the outcome definition, and this is very important, most of the proposal I reviewed had an issue with outcome definitions. I have a different definition for clinical cure, different than Dr. Khalid's definition, different than Dr. Haiva's definition. So you should always go to the literature and take a well-referenced definition for the outcomes to make sure it's consistent and this definition is reliable. So one of the mistakes is defining clinical cure based on their clinical experience only or their judgment. However, definitions are different between people, so you should always use a well-referenced definition from the literature, and this could be a weakness point when you submit your study for publication if the definition was not well referenced. And you should also specify the primary outcome, the main result that the study aimed to measure, for example, in hospital mortality, clinical cure, and so on, and the secondary outcomes, which include all other outcomes. As for the sampling method, it can be either random sampling, stratified sampling, where the population is divided to subgroups, or convenient sampling, where all participants are selected based on availability. And then the data collection method, you should also specify that in the proposal. Is it going to be survey or questionnaire? You should attach the questionnaire to the proposal. Is it going to be interviews or structured data collection instrument that collect patient data and clinical outcome? Whatever was the data collection method, you should specify it and attach the data collection form to the proposal you are submitting. This will increase the chances of acceptance if your research proposal is complete from all aspects. And the data analysis plan, as was detailed by Dr. Khalid, the use of statistical method should be specified in the proposal. And then we move to the ethical consideration, and this is very important. If there is informed consent is needed, you should write that patient will sign informed consent. If it's not needed, you should also highlight that informed consent will not be needed. And confidentiality and privacy, you should protect the personal information of your included participant. And research integrity, you should commit to honesty and transparency while conducting the research and avoid any fabrication or plagiarism. And the data management, you should establish a data management protocol and specify it in the proposal. Then we move to the timeline. Some of the research approval entities will request a specified timeline in the proposal. So basically you will write the steps of the research and the expected timeline for each step. For example, data collection will take about 2 months, data analysis will take about 2 weeks or 3 weeks, the initial draft will be written in, for example, 4 weeks, and so on. So it's an initial timeline for the proposed project, and it's very important also to identify the author's role from the beginning, who will be the principal investigator, who will be the co-authors, what will be the role of every participant to make your life easier when conducting the project, not only while submitting the proposal, but most importantly after getting the approval, so every participant will know their role in this project. Then citation, and this is a very common mistake that when reviewing proposal also I have faced a lot, that some of the researcher, they write or they add informations without proper citation. If I know it's a proposal, it's not it will not be submitted to a journal. However, it should be well referenced and every sentence used should be cited properly. So it should verify the accuracy and the completeness of each reference and maintain the consistency in formatting throughout the proposal. Some extra tips for writing a proposal include to use the reporting guidelines. For example, this is the care report or the care checklist for case reports. You will find criteria that will help you in conducting or basically in writing your manuscript. You want it to follow those guidelines. And we also have the strobe checklist for cohort studies. So if you can see in the title and abstract, they indicate that the study design should be written in the title and so on. So we'll give you hints how to make your manuscript better written. We also have the Prisma guideline for systematic review and meta-analysis and so on. So things to avoid while writing research proposals include the lack of clarity. It should be very clear, and you should avoid any vague statements that might confuse the reviewers. Also, weak research question. Ensure that your research question is smart, as we mentioned earlier, and you should avoid any broad or poorly defined questions that lack any focus. Inadequate literature review is a common mistake that we should avoid, and you should also cite your key studies. Do not ignore any landmark trials, and do not ignore any important studies in the field of your research question. Weak methodology. You should avoid vague methodology that leaves the reviewer uncertain if you will be able to conduct this project. And lastly, plagiarism. And as we said, plagiarism is the act of passing off someone else's work as your own. It's a common mistake when researchers copy and paste from previous research. So this is wrong and it should not be done. And actually, some of the approval entities and others, even journals, they will check for plagiarism, and they have a specific percentage. If it exceeded that, your paper will be rejected or your project will be rejected. So it's very important to know plagiarism and to avoid it. So example is copying paragraphs from other papers, submitting others' work as your own. So how to avoid it? You should always cite your sources when paraphrasing or quoting, and you should paraphrase the information in your own words. Okay, so I think I'll take 5 more minutes, but we will practice in this example. So during your coverage in COVID-19 pandemic, you had a case of severe COVID-19 in a patient with a chronic kidney disease. You wanted to start tocilizumab as immune modulator for this patient. However, during your literature search, you didn't find any studies that evaluated tocilizumab use in critically ill patients with COVID-19 with baseline renal impairment. So the question you had in mind is whether tocilizumab is safe for critically ill patients with baseline renal impairment or not. So you faced the case, you generated a question in your mind, you didn't find the relevant literature, and as we said, any unknown in the practice field is a potential research idea. So you decided to conduct a study to evaluate the safety and efficacy of tocilizumab in COVID-19 patients with renal impairment. So what you suggest as a title for this study? Okay, excellent. So this is a specific title suggested by Dr. Khalid. Okay, so the safety and what I went with is the safety and effectiveness of tocilizumab in COVID-19 critically ill patients with renal impairment, a multi-center cohort study, and I chose to put safety first because my primary objective was to see the safety or to evaluate the safety in this population. So the aim is to assess the safety and effectiveness of tocilizumab in critically ill COVID-19 patients with renal impairment. The study design will be a multi-center cohort study, and the population is critically ill patients with baseline renal impairment. So the inclusion criteria: critically ill adults, patient with COVID-19 with a baseline eGFR of 60 or less. The exclusion criteria, we added death within 24 hours of ICU admission and patients on dialysis at baseline. So what do you suggest for primary outcomes? The rates of AKI, since we are primarily evaluating the safety in those patients. So the development of AKI during ICU stay. Secondary objectives might include the need for renal replacement therapy, mechanical ventilation duration, length of stay, and all the other complications that could occur during the ICU stay. As for the sampling methods, we chose convenient sampling. All patients meeting the inclusion criteria will be included. For the data collection methods, it's a data collection sheet used to collect all relevant information. As for the data analysis plan, we added a specific data analysis plan for continuous variables and categorical variables, and we set the significance level at less than 0.05. And all the, طبعا you should specify which statistical software you will use. So we added Stata as the statistical software that will be used. So we actually conducted this study under the umbrella of SCAPE platform. And the title was The Use of Tocilizumab in COVID-19 Critically Ill Patients with Renal Impairment, a Multicenter Cohort Study. So this is the introduction. As we said, we divided the introduction to background, literature review, gap, and aim. In the background, we included COVID-19 mortality rate, complications, pathophysiology, treatment modalities. Then we talked briefly about tocilizumab and the NIH guidelines recommendation regarding using tocilizumab. And then in the literature review part, we highlighted what was done in previous studies, and then we moved to the gap of the research by highlighting what was missing in the literature. As we said, there is a limited evidence about the effect or the benefit of tocilizumab in critically ill patients with COVID-19 with renal impairment, in addition to a higher baseline risk of renal impairment in ICU patients. The uncertainty of tocilizumab safety and efficacy in patients with renal impairments need to be investigated. So this is a clearly stated research gap. And then a specific, measurable, achievable, and relevant aim was stated by saying the objective of our study was to assess the safety and effectiveness of tocilizumab in critically ill patients with baseline renal impairment. So with this, I conclude my presentation. Those are my references, and thank you for listening.